Some new questions about Obamacare and whether recent delays to key parts of the law mean that, well, maybe the president is backing away from his crowning achievement. The administration recently postponed the mandate requiring businesses to provide health insurance to employees, gave some insurers another year before consumer costs are capped. Of course, the waivers, who can forget that? So does this prove even the president thinks Obamacare is in trouble? Wyoming Senator John Barrasso, chairman of the Senate Republican Policy Committee, is also a member of the Senate Foreign Relations Committee, and I should point out, is also an experienced doctor, so you're eminently qualified to talk about this. But look, given all of the caveats and the waivers and the delays that the president himself has carved out of his own law, does that suggest, number one, that this is deeply flawed, and number two, that even he is retreating from something that's unraveling?
Greg, thanks for having me. Yes, I believe the president is retreating, and he should be retreating because you're right, this is unworkable. It is unaffordable. The American people wanted health care reform because they wanted affordable care. And what we're seeing under this health care law is that the cost of care is actually going up. The cost of insurance is going up instead of going down, and people are losing what they have that they may like. Just yesterday, it came out in the state of New Jersey, 100,000 individuals will, come January 1st, lose the insurance policy that they like. It's a basic, essential plan. It's good for young families, for many people who are self-employed, for small businesses. Yet, under the president's health care law, those are going to lose that insurance that they like.
Yeah, 60,000 are already getting their cancellation notices out in California. I think the number in Maryland is 12,000. So much for the promise you get to keep your doctor and your coverage. But look, I want to throw a poll up on the screen. This is a Fox News poll. 63% think that it needs to be changed and Congress should keep at it. But, Senator, there was a column in the National Review that said in order for your party, Republicans, to be credible with the American people, they really need to devise a plan of their own, unite around it, and sell it to the American people. Fair point?
Oh, I think it's a very fair point. We need to repeal the health care law that is out there now that is driving up the cost, and we need to present the plan that shows how we can actually lower the cost of insurance and the cost of care. That allows people to buy insurance across state lines. It actually gives individual incentives for people who stay healthy. You know, under the current new Obamacare regulations, no matter what you do to try to stay healthy, you're still paying much, much more than other people because of what's called the community rating. There are no incentives for people to stay healthy. This health care law does nothing to deal with lawsuit abuse. So there are a number of things we can do to bring the individual market back into play and put people in charge of their decision making as opposed to the government. The government decisions is drive up the cost of care and don't put in place the competition which works to lower the cost of care.
You know, a lot of businesses, and this is another aspect of it, are beginning to fire workers. They are turning full-time workers into part-time workers to avoid the Obamacare mandate. So the law, does it not, acts as a job disincentive, which can only harm economic growth?
The current law is hurting jobs, it's hurting paychecks, it's hurting families, and it's hurting people's ability to get care. You're right. They're pushing more people into part-time and lowering the hours of part-time workers to get them under the 30 hours. Businesses are looking at this, and it's not just businesses. It's school districts, it's small communities that are saying we can't afford these mandates under the president's health care law. These are all parts of the problem, but I'm expecting additional delays to come out, and I would predict to you, Greg, that they did this over the 4th of July. I expect there's going to be more things coming out over Labor Day that this administration is going to try to hide from the American people. They realize this law is not working.
If the individual mandate is delayed, that may have a cascading effect on the entire structure, which could collapse. Senator John Barrasso, we'll leave that for another occasion. Thanks so much for taking a few moments.
Thank you, Greg.